Hello, I'm Jawad and I'm the Executive Medical Director at East Lancs. This is my update on the 24th of January 2022. I know it's a few days into the new year, but this is my first update in 2022. So, a very happy new year to all the colleagues and wishing you the very best of health and prosperity. I'll very briefly mention about what's happening in the community. Now, at one stage in December last year, the community transmission rates were very high, almost 2,500 per 100,000. That was quite a scary number because when we had the first and the second wave, the maximum numbers we were having community transmission was anything from 800 to 900 per 100,000. Hence, figure of 2,500 was very scary. That did lead to increased attendances, but thankfully, the severity of the disease was far less than what we had seen early on. But despite the fact, yes, we were still getting people in intensive care and in our general and acute beds. Um, the community transmission rate is now going down. We are just under 1,000 to 900 per 100,000. So it is a positive move and direction that we are seeing. The number of patients who were initially admitted with COVID in hospital in mid-December, were about 30, but within a few days and weeks, it went up to as many as 180. So you can see how that rate increased. Similarly, at one stage, we had just one or two patients in critical care, but the maximum we had was between 8 and 9. The worrying bit is that majority of the patients in critical care are unvaccinated, and hence you can imagine our emphasis to all the colleagues in the organization and all to our member of public in community to have the vaccine, because what we have seen is that the people who get admitted to intensive care majority are unvaccinated, and hence they suffer the severe consequences of the disease. In keeping with the vaccination, my request is please do the necessary. It's never too late. If you didn't have the vaccine so far, there are plenty of opportunities where you could avail that. Have the vaccine, as it gives protection to you and your loved ones from preventing having severe effect of COVID. COVID with Omicron variant is still quite high, and hence we want to protect our population and most importantly our health service. So it's a request that please approach the right resource and get the vaccination done. And get a full course of vaccination. There is a lot of myths about the vaccination, and we have over the months and last year tried to do the myth busting in regards to vaccination. The second thing, as you probably have seen, is that the government is easing restrictions in the community in England. Whilst it is a welcome move that it will help people move more freely and have less restrictions, we in hospital are very mindful that a number of restrictions remain in place. And this is to protect our vulnerable, both vulnerable patients and staff and everybody, in fact, in community. So we would be keeping in place the mandatory wearing of the masks, the social distancing, and hand hygiene. Things will not be changing in the hospital in regarding the IPC principle. We are continuing with the visitors, but please access our website and you will be guided through the principles of how visiting is ongoing. Um, our activity to restore the backlog is ongoing, but as you can imagine, with the higher community transmission rate, our staff has also been affected, and hence there has been some impact on not being able to carry out whether it's a clinic visit or a theatre session or a diagnostic. but the teams are very much sighted on it, and they are continuing to put in measures which will help catch up with the backlog. It will take a number of months, I would say, to do what we lost in time in 2020 and 2021. That's all I have for this week. Look after yourself and do the right thing, and I'll update you in a couple of weeks' time. Bye for now.